This here is exactly what you need to do when you find yourself in a situation where someone has been burnt, maybe an adult or a child, or maybe even yourself. But before we dive into that, we need to know what burns are, the degree in which we classify them, and also we'll talk about how to prevent yourself from getting burnt. By definition, burns are just simply an injury to your skin or your organic tissue by most commonly heat, but there's various things that can cause burns: electricity, it can be chemicals and all these things. But for the purpose of this video, we'll just talk about mainly the things that burn you like commonly in our day-to-day lives. In terms of classification, I'll refer you to this photo. Burns are classified mainly in 3 degrees, and this is just based on the layer that they affect, and based on each and every layer, and based on also what is found in certain parts of the skin, you can have different symptoms. For example, in the first degree, you usually see it's just literally reddish around, and majority of the times you will not see these blisters form. But in the second layer, you'll get to see these blisters form. These are very painful because now they're affecting the areas where your nerve endings are found. In the last layer, these might not actually be painful at all, and you might think as if it's not serious, but these can actually go so deep and reach your inner tissues. So not every burn will require hospital admission. Some are more serious than others. Some will be very small that you even know yourself that this can be handled from home. But there are certain special areas where when you've been burnt, you need to visit a hospital. Number one, your face. The face is a very, very delicate area. If you've been burnt on your face to whatever degree, please go to the hospital, be assisted, because one, in that same area when you've been burned, it's possible that you might have breathed in some. We call these inhalational burns, like breathing through your airway. Now, in your airway, when you take in this heat, be it smoke and whatever, your airway can become inflamed, so it becomes swollen. And this swelling can end up blocking your airway, and this is very dangerous. So if you've been burnt on your face, please visit the hospital. They are seen properly. Another particular area that you have to pay attention to are the joints, especially in children. Burns around this point, if not properly taken care of, may heal like this, as shown in this photo. This is called a contracture, and this limits movement of the particular joint. And also, you taking care of it at home, you might not be moving the limb as it's supposed to be moved, so it becomes very stiff. Another particular point is the most important, which is your 1%, your private parts. So there, when you've been burnt, please go to the hospital and you'll be dealt with accordingly. Now, when it comes to the first aid, you should know that there is aims of the first aid. If you understand the aims, you will know what to do. Number one is that we're trying to prevent infection. Secondly, we're trying to prevent progression of the same burn. We're also trying to reduce swelling, we're trying to relieve the pain, and particularly in children, you're trying to prevent the child from going into a low temperature, which is hypothermia. So this is exactly what you need to do. Number one, when someone has been burnt, get them out of that same danger area. Get them out, and then you have to remove anything that's on them that might actually catch fire. Things like clothes, even watches, the bracelets, you get them out. In an event like, let's say someone was burnt, like your clothes are actually on fire, a technique can be done where you can roll the person over so that it helps with quenching the fire. Number two, after getting the person into safety, is that you have to use running water to pass it through that same burnt area. Water is like the same tap water. You pass it through that point mainly for two things. One, it relieves pain as it's cooling. And then number two, it prevents progression of the same burn by cooling it. Now, this is a point where you don't have to use ice. I'm going to say this again. Don't use ice. The problem with ice is that it makes the wound deeper and it makes the wound very cold. And especially in children, children are at very, very high risk of hypothermia. Hypothermia is a very low temperature. Now, compared to adults, children deal with this very differently. This can cause a lot of complications. So I'll say this again. Don't use ice, children of God. The next thing that you can do is use something like this. And this is a cling wrap. I hope I got that right. This is just going to help you prevent any infections from going on that same particular area. It also prevents fluid loss and also heat loss. So it kind of minimizes the extent to which this burn can actually worsen. After you've done these few things, rush this person to the hospital where further care is going to be done. Now, these are the things that you don't need to do. Number one, don't put cotton. Don't put butter. Don't put Colgate. Don't put Vaseline. I've seen a lot of people with burns and then they come to the hospital like this. Putting these extra things might actually infect the wound and then worsen its healing process. And secondly, I'll say this point once again, do not use ice. And number 3, there's certain burns that will form blisters, these small circle issues there. So these act as a natural barrier to prevent you from getting infections. So if you find yourself in a situation where you have these blisters, do not pop them. And then lastly, there are certain situations where you've been burnt and then you have something that's attaching to your skin. Do not attempt to remove it, because removing it is going to literally deepen the wound. So this can be done in a hospital setup, where when we do actually remove it in the safest way possible. So the key point of this video is that burns are very easy to manage. Do what you can from home and then quickly rush the patient to the hospital. Particularly in children, do not overcool them. Hypothermia is very dangerous in children. So in as much as you are using the running water and not ice, do not put them at risk of developing a very low temperature. So do what you can in the 15 minutes and rush this child to the hospital.